So the first and most powerful steps to prevent cardiovascular disease are healthy lifestyle changes, eating well, staying active, not smoking, sleeping well, and managing stress. Sometimes, though, lifestyle alone isn't enough, and this is where medicines can play a vital supporting role. Statins help to lower bad cholesterol and protect our arteries. We use blood pressure medications or antihypertensive tablets to reduce the strain on the heart and the vessels. And we know that diabetes medicines help control blood sugar and lower heart risk. Think of medicines as a safety net. They don't replace healthy habits, but they do add that extra protection when needed. So, using both together gives us a much better chance of preventing heart attacks and strokes. They're certainly not the first thing that we want to do, but in a lot of ways, they can be really useful in preventing and lowering cardiovascular risk in patients who have already maximized their lifestyle interventions and are still finding that their cardiovascular risk is remaining elevated. Okay, so to summarize, cardiovascular disease is common, but it's also really preventable. So please don't be downhearted or dismayed by anything we've talked about tonight. The take-home message is that this is something that we're really going to work with you to help to reduce your risk and improve your heart health so that we can live long and healthy lives. Eating well, moving more, quitting smoking, drinking less, these are some of the key things that we can do. Start small. These things can add up and to make big differences. That is going to reduce your cardiovascular risk, reduce your risk of heart attack, reduce your risk of a stroke, improve your blood pressure, cholesterol, and stop you from getting diabetes. We've given you a lot of information tonight about knowing your numbers and also using medicines if needed, because these can be really helpful as well. And last of all, I would say that we want to also signpost you to some really reliable resources where you can go and find extra information. So these include Understanding Your Heart Health from the British Heart Foundation. This is a great leaflet. They've actually got ones about cholesterol and diabetes as well, and different medications and different facets of cardiovascular disease, including stroke. So have a little look on their website. They can be downloaded, can get paper copies as well. NHS Inform, they've got a great search engine, so feel free to use it to search up cardiovascular disease or statins or cholesterol, whatever it is that you're particularly worried about in terms of your modifiable risk factors. Diabetes UK, got some great resources on there, and Quit Your Way is the Scottish Stop Smoking campaign. And like I said, you can walk into your local pharmacy. They have a free smoking cessation service, and they will be really, really keen to help and support you. So use the local services around you, and also feel free to come and speak to us here at the practice, because we want to support you in being able to make those changes that are going to last to reduce your cardiovascular risk. I hope that you found these series of videos helpful, and you can reference them anytime. Also, feel free to contact the practice if you have any particular questions, or ask your healthcare your GP, your pharmacist, the nurses here at the practice, if you come for a blood test, what those results mean if you're not clear about what they are, or if you need help or support in reducing your cardiovascular risk and making efforts to modify lifestyle interventions.